This episode is brought to you by Dr. Khachikian of Black Hills Regional Eye Institute. You can check him out on Instagram, SteveKMD1. Check out his website, stevekmd.com. He's an ophthalmologist, board certified right here in the Black Hills. For all your LASIK, cataract, PRK questions, contact Stephen KMD.
And you clap so you can sync your audio with the audio on the camera. It'll pick it up, and then you'll see it when you record.
Oh wow, I see. That's pretty. It's easy to sync that way. Yep. Boy, you have done your homework, my friend.
I've had to. All right. Thanks for joining us, everybody. Today we're here with Dr. K from Black Hills Regional Eye Institute.
Yes, sir.
Khachikian,
that is it. Okay. That is right.
I'm like horrible at pronouncing everybody's names. I always get it wrong.
Dr. K is good. Patients have trouble too, so that's why Dr. K works real well.
Thanks for being here, man.
I'm excited. I am so excited. Your setup is so legit. I mean, we were talking about this kind of off the air. Podcasts are such a big deal these days, and I thought about starting my own. And so to see this kind of in action, starting from the ground up, really kind of grassroots effort.
Yeah,
I appreciate it.
I believe in more professionals actually need to start doing this so people can check things out. You know, it's actually like kind of uncomfortable to get to a doctor or anything and talk to them about stuff. But when you run over the information and watch something, then they start recognizing the information a little better.
Yeah, and there's a little more engagement, and that's what I think. That's what a lot of what patients need, to hear some of that. Yep. And so if you can put it out there on a free level that's local, like Black Hills Podcast, you can't beat that. You can't beat that kind of information for patients and distribution on any level, for any business.
So before we started recording.
Yep.
So I had a friend of mine on who was talking about hormones, and she said that people with eye problems have a problem with melatonin in their eyes.
Okay.
Because it doesn't go away as much.
I see. Interesting.
Yeah. So people with low vision have a harder time sleeping.
I can see that.
Yeah.
Because of how they absorb or react to the light that they don't have those diurnal variations that we're all accustomed to.
Yeah, and I have a huge problem with sleeping.
Do you really?
Yeah.
Okay.
Because everything's shadowed. And
right, and you're just things aren't as clear as they could be.
Yeah,
and so then that gets over into your sleep.
So yeah, my problem, 2014, when I started losing my vision severely, the scarring over my eyes and everything.
Right.
Was apart from this skin condition that I had, was like the rosacea, like the blood and the red blood cells making my vessels blow up.
Right.
Okay.
Right.
And I got that under control, went to Black Hills Dermatology and saw Julie.
Oh, great.
And I recommend her. She's good.
Awesome.
Yeah. But the stuff they put me on, it like dries your eyes out severely.
I see.
So contacts are out, even if you do wear them, because I mean, they're just so dry, and they make your eyes really tacky.
Okay.
Yeah.
So, it's just uncomfortable.
Yep. But even after I got that done, like you said before, it doesn't fully come back.
Right. Because with the rosacea, and when it's not under control, it can get into your eyes and cause some scarring. And once you get to that point where there's scarring, you can improve it, but you can't really reverse it.
Yeah.
And that's why I think one of the first times I saw you, it's like, well, we can help you, but if the rosacea doesn't get under control, then the eyes are not going to be able to get under control, because you're just kind of, spitting on a fire here. You got to get this whole kind of inflammatory issue under control, and then we can manage your eyes. And that's where you're at right now.
Yeah.
And I would just remember being like, I can't help you the way you need to be helped from an eye standpoint. We need to see a dermatologist.
I've always wanted to do it. But it's like 1,000. It's like anywhere from like it depends on what milligram you're using.
Okay.
For Accutane is what I used, and it's anywhere from $700 to $1,000 a month for prescription.
The
It was
Accutane was.
crazy price.
Oh, wow.
Yeah, so you do need a really good insurance
Well,
plan
and
before
that
you
was
get
part
on
of the issue too, right? Initially.
Nixon.
Nixon. Okay, sure.
Okay, he's the one who did my evaluation,
Yep.
and he looked at my eyes and he's like, "You got 4 conditions going on here."
Mm-hmm.
Because I went to Abraham for the blood clots
Yep.
in my eyes,
Yep.
and then I had the scarring on my eyes, and then he said I had eye ulcers that took out a bunch of vision.
Right. That comes from rosacea too. But
Yeah.
dude, that's why I'm so excited to even be here, because I know you were not in you being your best self when I originally met you, and then to see how far you have come around to set up this whole podcast on with the setup the way it is, with the distribution that you're going to get. That's awesome. And that's just goes to show anybody can do that.
Yeah.
You just gotta, just like you said, it's like, how did you learn this? It's like, well, I read a whole lot and I got it set up. And so that's just awesome.
You got to light a fire under your ass, because it's you're in a position where you're kind of stuck in life and you need to find something. And I was just like, look, man, I'm in the perfect position now to put all my time into this. So
Yeah. It's just the mindset. It's like, this is what I'm going to do. And then I am just excited.
thanks, man.
Excited about it because I want to do it. I want to get my own podcast, and it takes some effort and some research, and just to see you and be like, okay, he did this. I can probably do this. I can get this set up.
I think, yeah, anybody around here in the Black Hills wants to get a podcast set up, I would be more than willing to help them out. And I'm not in, like any competition. So, I mean, I think we need more of these.
Right. It's not, that's not what it's about at all. It's just about getting to know people in your community, getting the word out about whatever they want to get the word out about. That's exciting.
Yeah.
And, so yeah, congratulations, dude.
Thanks, man. So, I want to learn a little more about, when I first saw you,
Right.
I was demanding to get corneal transplant.
Yeah, you really wanted. I mean, I don't think you liked me very much. As I said, that was not that was not the best thing for you.
You never want to hear that from a doctor that they're not going to help you.
Yeah,
but there's a good reason why you did it.
Yeah, I mean, you have to know. I mean, we could have done them.
Yeah,
it wouldn't have been like, I wouldn't say it wasn't totally inappropriate to do that, but when you don't have all the steps set up for that to be the best result or the best plan for you, then it's not going to go well. I mean, transplants, if everything, the conditions of the eyes are not healthy, a corneal transplant or partial or full, it's not going to go well. And so then we're going to be battling with this whole other problem. And you know what? If you have a transplant that doesn't go well, then it leads to another transplant.
It rejects.
It rejects. Yeah. And then, you could get an infection. You could lose your eye. It's scary. I mean, so we don't want to go that direction.
I think it is a major thing that people do. They go through when they get the transplant. But if it's your last resort,
well, if it's all you got, or if it's medically the thing to do, then I don't have any problem doing that. But if you've got other options, and I like to operate, that's what I do. I'm a surgeon, right? But in my opinion, if there are other options for you as the patient that don't involve surgery, we kind of got to at least explore those a little bit first.
Yeah.
Especially when you have a chronic condition, because what it means when you have a chronic condition is you can control it, but it's not going to go away.
So medications, do they affect, like if you get a corneal transplant, does it affect the healing process? Like if you're on some sort of...
It can, so you were talking about Accutane and using that to keep your rosacea under control. And that's like a double-edged sword, right? Because it keeps the rosacea under control, which is good for the eyes, but it also dries them out, which isn't good for the eyes. So then you're kind of riding this balance. And that's the key. That's kind of, the art of medicine, as they say, to find what works, but not overdo it. And that's a tough place to be.
6 months is, I think, what you do on that. I was like going nuts. But rough. I went 4 years without contacts, glasses, or corrective vision because I had that scarring. And it's what it looks like. It's like wearing glasses outside when it's cold, then you come inside and then they fog up.
That's what it felt like for you. I see.
But you just can't take them off.
I see. But now you wear the scleral lenses.
Now I wear the hard contacts.
Hard contacts, yeah, but they're bigger, right?
Oh, yeah.
Yeah, so they call those scleral. And you do fill them with fluid in your case and then put them on?
Yeah, so...
Yeah, those work very well for people with dry eye or certain eye. Dr. Sherber does an excellent job with those.
Yeah.
There's your plunger. Yeah, that's a big
And this
plunger.
is how you take it is. And
That's
this is
not
how
your
you take
average hard contact plunger.
You take the contact out with this, and not you don't squeeze it like a soft contact. You take it out with this, and then I'll forever be on a steroid.
Yeah. How many times a day you use that?
I only use it a couple times a week.
Good.
Because it is a strong
Yeah,
stuff.
that's a strong one. It is.
But this actually does, like, I'll always be on one just because my retina's too and stuff.
Right. Yep.
So this is expensive too if you don't have insurance. It's
It
like
is.
$300 just for this tiny little thing
Yeah.
here.
Yep. Those drops are expensive. Sometimes we have samples, but not all the time. Samples are.
Oh yeah, I always ask you guys for samples.
They're becoming a thing in the past. They're becoming
Samples?
A thing. Yeah, they are I mean, we used to have all samples of all sorts of drops all the time. This is when I first started practice, maybe 10 years ago, and now you kind of got to look through the cabinet. Do we have any? They're just not easy to come by. The drug companies don't want to give them out. And then you got your tears. Is that your tears?
Yeah.
Or is that Muro?
Is
They're
sodium chloride.
drops. Yeah, these are good too. These are preservative free because they're in those individual vials like that.
Yeah.
That means they're preserved, and those are quality.
You got to use one of these a day, and these are not cheap either. But these, when you put them in your contacts, oh man, they feel so good.
Yeah, and you know what? You got to see. You got to see.
You gotta sacrifice a little bit. You know, I mean, it's a pain in the ass taking them out, putting them in, and for those that aren't experienced with hard contacts, when you first start using them, it is absolutely scary, and they don't explain any of this to you because
they're not comfortable.
Yeah, they don't have any experience wearing them, but it's nice when somebody can explain it to you and they have experience.
Mm-hmm.
They got a little plunger that they use. They teach you how to use, and you got to put your finger under your eye. But I started cutting my eye.
Oh, yeah.
So this big one, you can take them in and out just with that one.
I see.
I would use that one because it's a lot safer. And you just go from like the middle of the contact to the bottom, and then take it and pull it out. And a lot of people I read on YouTube stop wearing hard contacts because they were afraid they couldn't ever pull them out.
Right. They can be hard for people to use, but for patients who have transplants, for patients who have severe dry eye, for a lot of eye conditions, those rigid contacts, if you can get used to them, will give you incredible vision. Actually, that's something when I do cataract surgery, I see patients who have been in rigid contacts, even with healthy eyes, for decades, like 30, 40 years. This is a regular thing. And the quality of vision that patients get in hard contacts, assuming, they don't have, if their eyes are healthy, they might still be wearing hard contacts. The quality of vision is superb.
Yeah.
And so then you're telling them, okay, we're going to get you out of your hard contacts. We're going to get rid of this cataract, but they want perfect vision when they're done because they had perfect vision.
So did I, because it is annoying.
Yeah.
When you can't see, the driving for one is out. Like if I did drive, wink, wink,
Right.
you can do like 35 miles an hour, but you go any faster than that, it starts to disappear. And you're not used to that. Like your whole life you drove, your whole life you could see street signs, lights, and now
It's way hard.
It's hard for people to adjust.
It's a different life.
Yeah.
Yeah, but you know what? You figure out what you can do and you do it. Like this podcast. That's it.
Yeah, I mean, it's hard trying to find your niche,
right?
Like, because your whole life has changed.
Yep.
One thing too is when you're dealing with somebody with an eye condition that you're seeing for the first time or something, they are going through some sort of depression also, because it does affect your whole life, and then you are scared because you don't know what you're gonna do. Like,
the patient doesn't know what's coming or what the plan is.
Will you ever be able to see like you did before? And that's the scariest thing, because you start freaking yourself out. I lost my apartment, I sold my car, I sold my motorcycle, lost my job, and I was just like, what am I gonna do? I hit depression bad, but I didn't want to take any pills because I'm anti-pill. I just started hitting the gym, changing my diet.
Yeah, no, that's a proactive solution for sure.
Yeah, like I just started hitting the gym every day. So, and that's one thing when you start seeing patients, just, like, are you eating like crap? Are you feeding into this depression?
I see what you're saying.
Yeah.
Yeah, we don't often get to that level. One of the things, I did a TED Talk recently about doctors and patients, and one of the things that I'm realizing, and it's kind of all connected, I'm realizing that if the patient can really tell their doctor what's going on with them, like on an emotional level, just like you're saying, like,
Yeah.
Doc, I can't see. And now I've lost this, I've lost that. I'm really not doing well. So our goal needs to be to get my vision to a point where I can at least do X, Y, Z. Okay. Whatever that might be, maybe that's start a podcast, maybe that's, drive your car, whatever. So then I can say, okay, this is our goal. You might not be able to do all these things, but we'll focus on this one and let's make that work. But a lot of times the patients, they don't tell you that.
No,
they don't come out and say that because they're afraid, just like you said.
It is hard to get comfortable with a
Right.
professional because, they have a job. They see a lot of people. Sometimes they don't want to, they, just want you in and out. And that's how
Visits are
people feel.
quick. The visits are quick.
Yeah, they are. And a lot of people need to step up and start being like, look, man, this is,
Well, yeah, it's a two-way street, right?
It is,
The
yeah.
doctor has to do their job to try and get some information, but the patient's got to do their job and offer that up
Yep.
early on. That's why I think some of this social media stuff is good, because then I can establish a relationship with the patient before they even get in the office.
Yeah.
So that by the time I do see them, they're comfortable really explaining what's going on much more quickly than if walking into that room was the first time they've ever seen me or
It's-
heard my voice.
Just even how they have it set up and the environment is just, it throws you off your game. As soon as you get in there, you shut down.
Right.
And you do shut down because it's a freaking doctor's office and you're just
Yeah,
like,
you don't know what's going to happen.
Oh,
All right,
yeah,
do I need this?
absolutely.
Do I need that? Am I going to be on medication? Am I okay? You don't know how bad it is.
I was really insecure about going to get my skin taken care of. And I mean, I went in for the first time and this doctor just gave me some antibiotic and I was like, this ain't gonna do shit. I'm like, come on. I was like, I want to see somebody and I want to get some results. Because I mean, this is my whole life here and your skin is very, very important.
Right.
So I asked for a new doctor and I got one and she immediately knew what to do. She's like, we need to get to the bottom of this and it's going to be a hard, very drastic pill. You have to get blood work done. And I was like,
That was
I
the
don't care.
Accutane.
Yeah. And I was
Okay.
like, I don't care. Let's go. And we did it. And I'm so happy I did it. I feel better. This is as good as it's going to get. I'm not the prettiest guy on earth, but this is as good as it's going to get.
But it's way better than it was when I first met you. I can
Absolutely.
tell.
Yeah. I could probably post some pics and it was
Yeah,
brutal.
and that's rosacea, and it's tough for a lot of patients. But it's
is.
not just your skin; then
A
it's
lot of
your
blood.
eyes. Yeah, you just have to find somebody you're comfortable with. And
I was uncomfortable, man. I wasn't comfortable at all. But that's what you got to do, Women are better at it. They are upfront more about problems and stuff. And
yeah, in the doctor's office, you mean?
Yeah.
I think that's probably true.
women are a lot stronger, and guys are just, I need out. I don't care.
There's
I'll live with it.
there's nothing wrong with me. I'm fine.
I'll live with it.
Yeah.
Screw it. But
I can muscle through this or whatever.
eye health is one that you don't want to mess around with. When I go there, I do see a lot of elderly people there. At
Right.
Regional. I mean, a lot. And I'm one of the youngest guys that go there with as many conditions as I got.
Right.
But any friend I have, I do have friends. One guy just got his laser surgery.
LASIK.
Surgery.
Yep. Sure.
And he is so happy. He had thick glasses too.
Yep. Yeah, we do. We do a fair amount of that, and that's what's nice too. At least at the Eye Institute with the eye doctors, the patients tend to be very happy. So they might come in struggling with their vision, whether they have thick glasses or they have cataracts, or they've got some scarring for whatever reason. But there's a lot of options. We have a lot of options. And so at the end of the day, and this isn't true for every single patient, but at the end of the day, we can improve things for, a tremendous number of patients. And it doesn't take that long from an eye standpoint. Like your contacts, it takes a little time to get the contacts fitted, but
3 months.
3 months. All right.
It's
So,
a pain in the ass, but it's worth it. It's the last option.
right. But, and considering, let's say if we did a transplant, it'd be a year
Yeah.
and we'd still be working to get you where you want to be.
Yeah. I take him out sometimes after I put him in, and I think they're just gonna get better. I'm like, oh, I got to do this again, but no, it's just a little
Oh, it's
slightly
fuzzy.
foggy.
I
Yeah,
see.
it's always foggy a little bit. But for LASIK, insurance does cover some sort of portion of LASIK, doesn't it?
It depends on the insurance. I think that was more popular maybe 10 or 15 years ago. And decade or so, there's fewer and fewer insurance companies covering. A lot of what patients do is they'll put money in their health savings account because you can use that for LASIK.
Oh.
And so I think you can only put like $1,500 in there.
Do you guys do payments?
They do. Yep. They do payments.
Okay.
They do care credit, but a lot of patients, especially around like December, January, they'll put $1,500 in, get one eye done in December. January, New Year starts, put another $1,500 in, get one eye done in December. And then what happens is it's tax free. So the money you put in your health savings account isn't taxed.
Oh.
And so you save a little that way.
So if you're rich, you can just start dumping money in there.
Well, 1,500 is the most you can do, though. That's the
Okay.
thing. So that's why people do it just at the beginning and just at the end. And, health savings account's not a bad deal.
Yeah.
I don't personally use one, but you can get things like you. So if you have the option to do that, and I guess I don't know, you can get probably your contact lens stuff.
I actually was trying to get you to do LASIK, but you said there's...
On you?
Yeah.
Oh, man. You were just nuts.
I was just desperate
You had
to
no
get
idea.
anything done. But you said there's different colored lasers that you use?
Let's see. There's different types of laser for
Different
sure.
types of lasers.
There are different types of lasers
What
for
are
sure.
they?
There's depends on what we're talking about. But now when we do LASIK, there's what they call the excimer laser, which actually reshapes the eye. But they have what they call the intralace or femtosecond laser. Intralace is the brand name. And that actually makes the flap. Probably a little over 10 years ago, maybe 12 to 15 years ago, there was this big argument about how you make that flap, whether you use a blade to do it or whether you use a laser to do it.
How they pull the cornea back?
Yeah,
Oh, okay.
exactly. How they make that flap to pull the cornea back. And the blade guys are saying the blade's just as good, and the laser guys are saying the laser's just as good. And now, just as technology's evolved, you couldn't get a blade to make the flap if you wanted to. It's all laser.
Oh, okay.
And so, you go to another part of the world, that may not be true, but in the US, I don't know anybody who's doing bladed LASIK. So everybody's got femtosecond lasers to make the flap, or excimer laser to do the LASIK treatment. Okay. And so that's one type. And then there's PRK, which is similar to LASIK, but a little bit different.
PRK, that's what I was trying to get.
Maybe because there's no flap there. And so technically that would be a little more appropriate for you. But here's the thing. A lot of patients, probably like yourself, think PRK is going to make it better than it is with contacts. And the truth of the matter is PRK is only going to get you maybe as good as the contacts.
I have really bad retinas.
Right.
When I went to Abraham, we took pictures of him.
Rob, you got injections? Did you get injections?
I got 8 injections in 1 year.
Yeah.
And
that's okay.
for
That's
those
what
that
you
don't
needed.
know,
That's what you needed.
You get a needle in the eye, like literally needle in the eye. Hold still, and they just stab you and put it in there, and then they inject it.
But it works.
Yeah, well, a little. It didn't get rid of my
it works
blood clot.
Right, but it works. But it probably kept you from getting a lot worse.
Yeah, probably stopped it.
It saved your vision from getting worse.
I was 26, 27 years old when I first got my first injection in this eye. And then in this eye, I had 2 very big blood clots because my retina is thinning.
Okay.
So thin.
Yep. I remember you're pretty nearsighted. Yeah.
Yeah. The vessels just pop into your retinas. And that's what causes that.
Did they know what that was from? Was that from those pro hormones too? Or they don't know.
No, that was just from birth. I've always had really bad retinas, like they're so thin. And like, if you ever go blind or you ever see a flash,
let us know.
Yeah. Like, all right, like that's good to know. Yeah. But with the injections, I don't know. I thought it was going to get rid of the whole thing, but I guess it just stops.
Yeah, here's the thing about the injections. Again, 15 years ago, they didn't even exist.
Yeah.
So the fact that you can even get them, anybody with a lot of it is macular degeneration.
That's what I got.
Yeah, and you probably had what they call myopic degeneration, which is similar but different because you're just not older.
I probably got both.
Yeah, well, macular degeneration is usually an older patient. Myopic degeneration can be a lot of times a younger patient.
Yeah, my eyes are old.
We're wrong. We're getting old, dude.
I know, man.
We're not getting younger.
When I was there, she had an intern. Dr. Abraham had an intern working for her.
Sure.
And I was in there. I was like, I see you got a new girl. And she's like, I do. And I'm like, well, bring her in because I got like 8 conditions she can look at. I'm like, this is actually good for her. She's like, thanks a lot. So she brought her in and she's like, these are his vessels. This is what they look like when they're blown up. And then she showed her the
Picture on the
the retinas and how they look.
Did you get an IV injection to take those pictures?
Oh,
you
yeah.
probably had that a few times.
Yeah, they
right?
inject you with that
Yellow dye, the fluorescein dye.
Yeah.
Mhm.
And then they start taking pictures, and that guy, the one who does the photos of your
Dan,
eyes.
yep, Dan.
Yeah. He's a good guy, but
He's a good
always
guy.
gets so frustrated with me because
He can't get the image he wants.
Yeah.
He's an excellent photographer,
Particular.
and he's very particular about the
Yeah.
images, and your corneas are cloudy.
they are bad.
So you can't really get a good image. So yeah, I bet you he does get
He was
kind of
getting
frustrated.
It's like, am I holding still? He's like, yeah. He's like, can you stop moving your eye because my eyes shake.
Oh, okay, yep.
So I forgot what that's called.
Nystagmus.
Yeah, and they don't stop, and he's like trying to get a shot, and he's like, it's not focusing, and then he's got the cloud over my cornea, and he's just like, I don't know, man. He's
I
like,
could
good
just
enough.
see it.
He's like,
Yeah.
click, 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 click. All right, bye. But
That's funny. That is Dan too. I mean, he's real particular, but
Yeah. Every time I see him too, I'm always like, I'm back, and he's like, oh man. But he's a good dude.
yeah. Well, that's good. I mean, it's good. You have sounds like a pretty good experience over there, but it's scary.
It
And
is.
in your case, we can fix a lot of stuff, but we can't fix everything.
Yeah, there's a lot of places to go. But honestly, one of the best places is going to Black Hills Regional Eye Institute because you guys are very experienced with
Yeah, the
bad
doctors.
situations.
The doctors are excellent, all of them, really. I do myself as cataract and cornea, Dr. K, and then there's Dr. Spencer who does cataract and LASIK, and you got Dr. Jorgensen who does cataract and glaucoma, and you got Dr. Abraham, she's been there the longest at this point, who does retina, and then Dr. Tarbett, who does oculoplastics and lids and things of that nature, and even some of the more cosmetic stuff. And so I've seen since I've been there, a few of the docs now have retired. Dr. Nixon retired, Dr. Dirks retired, Dr. Hafner retired. And so it's a younger group of docs, but all who do a fantastic job. And so that's why I really enjoy working there. And that's why I think we need to do more social media, some more of these podcast type things.
Yeah. We're going to talk about some serious conditions here. And
Yeah.
people get a little more familiar with their eyes. It's some people don't pay attention to, like when they start squinting, like
Yep.
they're just like, I'm not used to this, but they start squinting a little bit. They should go in right away because the more stress you start causing on your eyes and your retinas, it will start affecting it and weakening the muscles.
Yeah, squinting is not really good. If you have to squint to see, then there's definitely an issue. And maybe it's only glasses, or dry eye is a big one, especially
Dry eyes.
Dry eye is just such a big deal these days.
Stress. People getting stressed.
Stressed, computers, phones, all this stuff, and it all just dries them out.
So what about rubbing your eyes?
Yeah, bad.
Is
Yeah,
it?
I don't know I don't know when I see a lot of patients with what they call keratoconus, which is a condition where the cornea shape actually changes from being more spherical, more like a globe, to more like a football. And it seems like, and this is becoming more and more true, that patients who rub their eyes significantly have this develop. And it typically develops, in the late teens, early 20s. It's a lot of allergy sufferers who can get it because their eyes are irritated and they rub them like crazy because it feels good. And then after doing that for 10 years, then all of a sudden the shape of your eye is changing. It's like, okay, we got to get this taken care of.
Most of the time when people rub their eyes is because they collect a lot of sleep.
Mm-hmm.
And like, what would they do to get rid of the sleep?
Well, I mean, I think there's two, from that standpoint, it's one, they could be dry, especially I just saw a patient who it's hot now. They're sleeping with the ceiling fan on at night. And so their eyes are drying out at night. So
Your eyes do have a tendency to open up a
yeah,
little bit
definitely
when you sleep.
some patients, not everybody, but there's a lot of patients where that happens. And then they dry out, especially if you've got the fan on, just like if you're sitting in the car and the hot air is blowing or the cool air is blowing right on your eyes. You're like, all right, this is annoying. Except when you're sleeping, you don't realize that until the morning and you wake up and you're like, what is going on here?
You hit that REM state and they start to get really dry. And if you have pets, the dander.
Yep,
actually starts to
absolutely.
what was it? I read something about eye mites.
They exist.
Yeah, I was disgusted. And it's like when people have their cats sleep on their pillows or their dog sleep with them, they get eye mites and they live under your eye. And
Well, I don't know. I can't say that those two things contribute, and that's just because.
I'm just gonna say that because my girlfriend has 2 cats and I don't want them sleeping with us.
But you do want to make sure that you wash your face, keep your eyes clean, your lashes. That's an important thing, because we're not talking about the greatest stuff here on this show. Eye injections, eye mites.
This is stuff that people need to.
Well, this is true. You are absolutely right. People do need to hear about this.
Everybody
it is true.
Has pets, yeah.
And it needs. And you know what happens with those? They call them Demodex. Is really what those eye mites are called.
Oh, okay.
And it's so underdiagnosed. And then, but as the doctor, you don't want to say, this is what you got going on. Usually, and the treatment's pretty easy though. You use a little tea tree oil. Tea tree oil soap is an option. It works. Those bugs do not like it. And so I'll put a lot of patients on that. I know Dr. Sherber does as well for the dry eye, because what happens is those things get in there, those mites get in there, and then the tears are irritated, the eyes are irritated, you get a lot of dry eye. And so those patients present and they say, my eyes are scratchy and irritated. Yeah. And then that's, dry eye.
I asked him about that too when I saw Sherber last.
Yep.
Because my girlfriend does have cats, and after I saw that video, I was losing my shit, man. I was
Get
like,
these cats out of here.
I was like, I'm going to get eye mites. And I sent her the video and I had her watch it, and she's like, I don't have eye mites. But when I went and saw him, I was like, do I have eye mites? He's like, looking, no, you're fine, Brandon. You're clean. No, I was like, damn, I was hoping kind of he would take care of it. I'd be like, I'm never sleeping in your house.
Yeah, get these cats out of here.
Yeah.
No, I mean, it's not common, but it's something we look for when patients come in with dry eye, especially older patients. Absolutely.
I didn't think you guys really did, but awesome.
No, yeah. If a dry eye patient, for sure, or a patient who's been to I see a lot of patients who've been to, a couple other doctors before they come and see me. Mm-hmm. And then I'm always looking for it, because it does get missed sometimes. So, and nobody wants to hear that either, by the way. I'm not everybody's best friend if that's my diagnosis. That's
going to be another thing people feel self-conscious about. If you have something like that, you're going to be like, oh,
right,
like having lice or something.
I agree. The patients do feel that way, but get over it, get it fixed, and move on.
Yeah, it's one of the hardest things, man. Just being self-conscious about something.
I know. Well, that's what kills. Even with I have the kids. I'm working with them when I have 5 girls.
Whoa.
Yeah. We have a blended family, but there's 5 of them.
Doing some breeding there.
They range in age from
5,
6 to 12. Yeah.
Oh, that's cool.
And so, really working to get them to be not self-conscious, have higher self-esteem, and be kind of open and honest about what they want to do, and less influenced by other people's opinions is a battle, constant battle. Yeah. Especially with social media is good for some things but not good for others, and so then you've got them watching whatever videos they're watching on Facebook or YouTube, and it's like, what, don't worry about that, don't watch that, you're the person you are, and you just be that person.
I think social media does make people more self-conscious about looks,
right,
and seeing other people really happy and stuff. It's bullshit kind of sometimes. But
exactly.
We're all normal human beings, man. We got good days, bad days. Here in the Black Hills, there's a lot of good people around here.
Oh, it's awesome.
And, yeah, I love it, man. It's one of the most beautiful places.
Yeah. Oh, and, well, let's get this. So my mom is in town from New York, and I grew up in New York. I lived in New York City, Brooklyn area till I was 18, and then I went upstate to college and was in upstate New York till I finished residency, really. And then I came out here.
Where'd you go to college at?
I went to college at Siena College, which is in upstate New York, Albany. And then I went to med school at Albany Med and did my residency and my fellowship there. Okay, and it was a good experience. And I was just happy to get out of the city and up to upstate New York, because even in New York City, parking is an issue. I was just complaining, parking. I can't park my car. So then I came out here, and the people are just different, and you can kind of your lifestyle is I don't know, at least for me, much more tolerable. It's less of a rat race.
Yeah.
You can identify with the people better and get to know them a little better. I still have a little New York in me too, but
absolutely.
just because I'm pretty blunt and pretty straightforward with some things, but it's awesome out here.
What do you think about marijuana and glaucoma and stuff like that?
Well, so
let's hear it.
It doesn't really provide as much benefit as the glaucoma patients need.
Okay.
I mean, if somebody wants to smoke marijuana, you know,
like the CBD,
whatever. Yeah, well, CBD oil is a whole different discussion, and one that I think I am not totally educated enough to discuss, because the CBD oil has benefits, and I actually don't know. You know, it's illegal, right? I mean, you can't sell it here. You can use it.
Actually, you can get CBD
You
here.
can.
I recently went up to Grassroots on the north side by Walmart.
Okay.
And I wanted to try it for sleeping.
Okay.
So
how do you take it?
It's a gummy bear.
Okay.
It's a CBD gummy bear.
There's a real fine line here, man.
They have the gummies. They have the drops, and they have the vapes.
They have drops?
Yeah.
So that's for glaucoma then?
Yep.
Really?
Well, no, not eye drops. They're like
under the tongue, sublingual type of drops. I see.
Oil drops. And
okay.
So I went there to check it out because it says on it, there's no THC in it. They
okay, so there's no.
THC
I see. I see.
No visual head
So it's
stuff.
just CBD oil.
Yep.
Because I was under the impression you couldn't get that in town either.
Yeah, I didn't think so either. But then I started doing research because I wanted to try some for anxiety.
Okay.
So I went and got some, and I tried 75 milligrams, which is like 3 bears, and it chills your body out a little bit.
Mm-hmm.
It's not anything like smoking marijuana and stuff.
Okay, but it's technically there's no THC. Okay,
no THC.
I need an education. I
yeah,
guess,
that's why it's legal.
Okay,
because there's no and when they take the THC out, you can take it. So, and then I read things about benefits from, like eye strain and stuff, and THC helping. So, or not THC, CBD.
Right.
So I was like, shit, let's get on it, man.
Yeah, you know, I am really pro sort of holistic treatment. If anybody comes in and says, I want to try this for this condition, I'll be like, you know what? You go for it and you tell me how it worked. But let me tell you this, if it's not working, we are going to start doing something that is, you know, more mainstream. So I don't have a problem using alternative therapies or holistic therapies.
I think one time
in conjunction.
I think one time you did prescribe me to get on cinnamon.
Cinnamon, yeah. Cinnamon works very well for eye inflammation. I'm surprised you remember that, but I do tell patients that, and it does work.
I was actually kind of pissed. I was like, this is expensive, and his doctor prescribed me cinnamon? Like, what is this?
It works.
It does.
It works.
Yeah.
And so anyway, I'm all for it. It might not be my first choice, but if somebody's got something that they want to try, then I wouldn't object to that at all, which is another thing that it kind of surprises me. I think some doctors are against those sorts of therapies, and they work. I mean, there's some that work. And I think one of the biggest problems is there's not real great documentation on what works for who and what might work for somebody doesn't work for somebody else. And so it's hard to say this is going to work for you. It's more like try this and see how it helps. But that's what we do with prescription medications too. Try this one and let me know if it works for you. It's just gone through some different testing. And so that's why I really think that's great. Well, you know, my wife owns Mainstream Market. She's one of the owners down there.
Oh,
so
nice.
I get stuff at home all the time to try. We're trying this collagen. We're trying this Curamed, or we're trying, you know, whatever it might be. And so maybe that's one reason I eat a lot of organic at home too.
That's good.
But I have 2 Diet Squirt and Irish cream coffee creamer. Those are my 2 things that I need in the house that don't come from there.
Yeah.
But anyway, so I'm all for those holistic things. Marijuana, I don't think it helps your eyes as much as people wish it did.
Yeah. Yeah.
So I'm going to kind of stay away from that one for a little while, but CBD oil, I don't know. I got to do a little more research into that.
Yeah. Do what? Cause I'm like pro.
So has it worked for you?
Decriminalize.
Did it work for you?
No, not really. It wasn't enough.
It wasn't helpful.
I think if I up the CBD about like 150 milligrams, like,
okay.
It's pretty expensive stuff though. I mean, you're dropping like 100 and something bucks on it, and I'm a pretty broke dude.
Right.
So,
well, I mean, yeah, you gotta.
If insurance was covering it, that would be awesome. But no, not right now. But when it does become decriminalized here, and you can start experimenting more, like Denver, I really don't know enough about it either. So I do need to bring somebody on to actually talk about.
That's a great idea.
Yeah,
that'd be a great idea to hear a little more about that.
And not just somebody who's pro marijuana, but somebody actually knows.
There are even academics here that know, and I bet you even at School of Mines you could find somebody who had a more professional background to discuss this.
What was that? I was watching the Rogan show.
Okay,
and he was talking about. He had a doctor on there talking about shrooms.
Okay, sure.
Used for PTSD to bring it down, the PTSD. And I was, I mean, I don't know, like you can sit there and point and, talk shit all you want.
Right.
But if it's from a scientific background and they're actually doing science on it, you can't argue that.
No, absolutely. And well, mushrooms are a big deal these days too. You got all lion's mane and what's it, chaga, and all these things that are those are mainstream things.
Yeah.
That are meant to either lift your mood or chill you out or whatever it might be.
Elevate.
Yeah. So there's a lot of stuff. I don't know if, again, can't speak to the eye from an eye standpoint, but there's definitely a lot of stuff out there.
So you do also with eyes.
Yep.
You ever like extracted?
No, they call that enucleation. That's not something that have I done that ever? Yeah. So when I was a resident, we would do those. But that's for patients who's real severe eye disease, and that's not fun. You
can do eye transplants.
No, so you can do corneal transplants, and there's all different types of those. That's one of the things that I do. But I'm trying to think of other portions of the eye that can be transplanted. There's eye stem cell transplants, which are kind of for the surface of the eye too. It's a cornea thing, so it's not like for the back of the eye. And they're looking into doing like retina stem cell transplants. So that's where, in your condition, where your retina is thin and maybe kind of broken down in certain areas, that would be kind of something where if they ever develop that, you want to know more about it. But they're still really researching that. It's kind of just cutting edge type of stuff.
I can't wait till they come out with like a bionic eye that's like a chip.
I know. So we'll be putting contact lenses in that give us, VR and updates and things like that.
I saw something about a lens you can get on your eye that's like a reading glasses or something like that.
Maybe. I mean, it depends on, you can get contacts that help with reading for sure. Oh, was it the camera inlay?
That's what it
was. Okay.
What is this?
So it gets confusing, but so this is more on the LASIK side. Okay. When we do, one of the options you have, I was talking about options for near vision. There's a lot of patients. How old are you?
38.
You're 38. So I'm 40. And, but as you get, in 5 or 10 years or so, all of a sudden that near vision starts to go.
Yep.
Okay. And so patients get very frustrated because they can't read like they used to, even though their distance vision may still be pretty good. Then they got to use readers, or they're taking the page and they're holding it way further out. It gets to be frustrating. By the time you're 80, you've kind of gotten used to the reading glasses. It's like, all right, I gave up on this years ago. Yeah. But when you're 45, it's frustrating. And so the implant is called a camera inlay. That's like the name brand. What it is,
that's an awesome name.
Yeah, it's we use the laser. So we were talking about lasers using to cut earlier. Using a laser to cut the cornea is the most precise and the safest way to do it. Okay, because if the laser slips, it's not a big deal. It sounds terrible, but it's like if the laser slips when we're doing it, we're like, all right, okay, let's just start over. If a blade slips, it's a big deal.
Yeah, your eye, they heal really fast.
Yeah, they do, yeah. And the lasers, it's computer controlled, so it shuts off. It's automatic. Okay, so anyway, we use the laser to make the incision, and then we put this little disc into the layers of the cornea. The cornea is probably like 0.5 millimeter thick, 500 microns. So we put that in there, maybe halfway down. Okay, and it's a little disc with a hole in the middle. And it enhances your near vision. They call it the pinhole effect, okay? Because almost like squinting. You know how your vision gets better when you squint? This kind of is it's designed to kind of squint for you. It sharpens things up. And so not only does it sharpen it up close, but it does not take away a lot from your distance vision, which is why patients like it.
Does it have like a
magnifying?
There's
no lens in it at all.
Oh.
No, there's actually, interestingly enough, there's no lens. That hole in the center is just
empty.
That. It's a hole. It's empty.
Oh, okay.
Exactly. But the light that's going through there, the way that works is it only lets the light in through the very center, which is focused.
Oh.
By definition, that light going straight through the center is focused, way back to your, light and physics days.
Yeah.
Light going straight through the center of the lens is automatically in focus. And the problem that patients have with blurry vision is you've got all this light coming from around the sides that then makes it blurry. So if you eliminate some of that peripheral light, not a lot, not enough to make a big difference, but enough to sharpen up what you're looking at, that's how that works. And it works very well, better than a lot of the other options. And so I don't love a lot of new stuff. I'm really cautious about new things in technology till they're really proven, because I don't want anybody to have any problems.
Right.
but this works very well. The patients are consistently happy.
Is this about the same like price range as doing LASIK?
Yeah, it's probably a little more than LASIK on one eye. It's probably a little more than that.
Okay.
I actually don't know exactly how much it costs. So, but I don't know. It's probably in the $3,000 range or something like that.
This is for like people who wear bifocals that are just over wearing them. And
well, it's for people really. One of the things is it has to be, you have to want to not wear your readers.
Yeah.
Like if you don't mind wearing reading glasses, then by all means, you go wear those readers. But if you're like, I don't really want to wear my readers anymore, it's kind of annoying, it's kind of frustrating, I just want a little better near vision, then that's the type of person.
Yeah, okay. So I have zero experience with reading glasses.
Yeah, are those them?
Yeah.
Did you start wearing those recently?
Check those out.
These are magnifiers.
I have
All
to
right,
wear
baby.
something because your eyes can't focus with these hard contacts. Like they're one position and that's it.
Right.
They don't go in and out.
What happens is it's not the contacts that are changing as much as I bet it's your eyes that are changing, because the lens in your eye naturally moves.
That's not what I want to hear.
Okay. Yeah, but
yeah, that's true.
And the lens in your eye naturally moves. It allows you to see from distance to near. But as you get older, that stops happening. Now you've been on a lot of different medications for your eyes. Yep. So in theory, it may be happening to you a little bit earlier. Okay. And you could probably adjust your contacts to help you out a little bit. That's one thing to know. But these are fine. These are normal. It's what people need as you have too many birthdays, and this is what happens. You need to put on your readers. And then if you get frustrated, it makes it bigger. It's like, oh, wow, that really helps, right? I mean, you put them on.
The hardest thing about wearing something like these when you wear contacts is as soon as you take them off, you have to wait for your eyes to
adjust. The eyes have to adjust, yeah.
And then you start getting a headache, and then your eyes start shaking more because they get tired.
That you'll work past that. That will stop after a while.
Yeah, I'm new into these, and I asked Dr. Sherber about like what are the best ones. These are actually a little too thick.
Are they? Where'd you get them?
Walmart.
Oh, cool. Yeah, that's just perfectly fine. Off the shelf is perfectly fine. The thing I find the most about some of those Walmart ones is sometimes the lenses
aren't there.
Well, they're just a little foggy, you know. So even I'll put them on, I'll be like, why does this seem a little foggy? And I think it's just the quality of the plastic of the lens isn't ideal.
Not high quality.
Yeah. And so if you spend a little more money, then the quality of the lens is a little better. So you actually wind up seeing a little better.
Like putting Tupperware on your eyes.
Well, yeah, a little bit like that. Yes, exactly. It doesn't have to be that way. It's not hurting anything.
Yeah.
It's easy for reading. And I think some patients don't even notice that, especially post-cataract patients, because they did not see very well to begin with. And so now we've made things better. And so everything is just better.
Yeah.
Even if it's a little foggy, it's still better. So they don't notice it either. We tell patients to use those over-the-counter cheaters all the time.
Yeah.
They don't hurt. They're fine.
Yeah. I kind of, these are clear, but they're thick. What was that you just mentioned? Cataract.
Yep, sure.
I don't think I have a cataract.
Mm-hmm. Okay.
But I'm pretty sure I'm going to develop one.
Well,
is this something you just develop too?
It is. So again, that's another thing I tell patients. Why a lot of people wonder, why do I have cataracts? And so it can be UV exposure. It could be medication. You've taken eye drops that are steroid eye drops, and those can develop cataracts sooner. Patients who take prednisone for asthma or autoimmune conditions can develop cataracts sooner. UV light, smoking is a big one. All those things contribute to the development of cataracts. But the number one thing is the number of birthdays you've had. If you've had a lot of birthdays, then odds are you're going to develop cataracts. Okay, and you might not even notice it, but they'll be there. And then, the point when you say, I'm just not seeing as well as I should, and I want something done about this, that's when we do surgery. There's really, for cataract surgery, which I do a lot of, there's basically two things. There's one, do you meet the requirements for like insurance coverage? And then two, do you feel like you don't see well enough and you want to have surgery? Okay. And most of the time, by the time patients have decided I need something done, they've already met the requirements for insurance coverage.
It's not a very serious procedure, is it, for cataract?
It's very common procedure. It usually doesn't take too long. The patients are typically very comfortable.
Like an hour?
No, it takes like maybe 20 minutes or something like that.
Wow.
Yeah. You might be at the Eye Institute for an hour or more, by the time you get set up. But usually the actual procedure isn't very long. And we're very good at it, especially at the Eye Institute. And so, but the thing about it is, if it doesn't go well, if there is a complication, that's when you want to be sure that you're at the right place with the right person so that things can be taken care of, because it's surgery. So, you know, I mean, there's always a risk when you're having surgery, and cataract surgery is extremely low risk, you know, like,
Oh, okay. Good.
yeah, you know, what the risk of infection is like, you know, 1 in 1,000 to 1 in 5,000. It's low.
As long as you keep it clean and sterile.
Yeah,
use the
exactly.
Sterile drops.
Mm-hmm.
Yep.
And so, yeah, I think that from that standpoint, cataract surgery works very well. It's very low risk. It's minimally invasive. Patients recover quickly, but it's still surgery.
You ever done a cataract surgery like somebody younger than me?
Yeah. Oh, sure.
Yeah.
Kids, even. You
Really?
know, yeah. Mm-hmm.
Wow.
You know, and that's usually congenital or trauma.
Oh, okay.
Okay. But even if you look back on some of those Facebook posts that I have, like there's one a long time ago, I don't know, a couple of years ago, of this like 6-year-old girl who has this white cataract from, I think it was from a trauma.
Yeah.
And, you know, just to be able to restore vision to her is just awesome. You know, that's really, you know, it's why I do what I do, to be able to hear what the patients have to say about how well they're doing, just like you, how well you're doing. When you can actually see how well you're doing after you've been treated, even if I didn't do it, you know, I'm excited for you.
It's hard to explain. Like when we go out and eat and I can't read the board,
right?
And my girlfriend will just look at me and I'll be like, babe, what is that? Like, I want the big picture. And she's like, okay, because that's all I can see.
Right. I know.
But yeah.
But, you know, just to know where you could be too.
I mean, yeah. Oh, but this is 180-degree flip and it's way better. And I do think more people need to pay attention more to their eyes than, like, I mean, especially if you're into boxing or something. Mm-hmm. That vinyl.
Yeah, that hitting the boxing. I've operated on a couple of boxers too.
Have you?
Yeah, and the surgeries on them are way different because they've had some trauma to their eyes over the last. Yeah, these guys usually, I mean, they've boxed in the Navy or whatever is usually the story.
Yeah, a lot of guys around here, they want to get into MMA too, and
yeah, I mean, that's rough. That's rough to watch sometimes.
It is. It's brutal, but it's awesome. But yeah, I mean, you do take a lot of strain in your eyes and your orbital and stuff. When it starts to break down, it'll start to loosen up this eye socket and get air in there. And I've done a lot of research about that too, because I used to do boxing.
Okay.
And I jumped in the ring one time. But I already have.
It's tough on your eyes, probably, especially.
Flat eyes or whatever. You know, the cornea is really flat. And it messed with my eye pressure and stuff. So it's not safe. And the fluid in it.
Yeah, you know, sometimes I'm surprised that the boxing is not even worse or more of a risk. But it's more, I don't see people who are boxers like acutely. It's usually, I used to box 20 years ago and here I am. It's like, all right, well, we'll fix it.
Yeah, they get lucky, I think.
Well, yeah. And the body is an amazing thing too. You know what I mean? Just the way it's able to adapt and handle stresses.
We were at the pool, Sioux Park, the other day.
Yeah.
And we were wearing sunglasses.
Right.
And they're polarized.
Nice. Okay.
Yeah, and there's a lot of people out there who aren't wearing sunglasses.
Crazy.
Yeah, I really don't know a lot about eye safety, like the UV protection. Like, how badly does that affect your eyes?
Well, it's just, you know, it's just like your skin. You know, you want to, if you're think about it, you're putting sunblock on your skin every time you go, at least that's the recommendation, right? Get it on there, because over years, that UV light is going to cause skin cancer changes that are not healthy. Yep. Same thing for your eyes. I mean, we're talking about not only cataracts, but macular degeneration, pterygia, which is a growth on the eye, any sort of kind of, you know, you can get cancer on the surface of the eye. You know, that's a problem. And so you want to, even my kids, I'm trying to get them to put their sunglasses on, you know, and so same deal. The nice thing about contact lenses, I don't know about yours, your scleral lenses specifically, but most contacts have some UV protection. So at least over that part of your eye, you've got some coverage. But, you know, these patients get lid cancer or this or that, or, you know, the cancers around the eye. The ear is a big one, so it's right there, you know. So you want to protect it, keep it covered.
Here being South Dakota, the snow reflects light.
That's a good point too.
Yeah, the lake reflects light, the pool reflects light. And I was thinking about that when I was down there, because I didn't have my sunglasses on because I didn't want a crazy sunburn or, you know, tan. I was just worried about
past that. You're 38. You got to be past that.
I was like, I'm gonna look weird on the podcast. But that's why I didn't have him.
That's that self-consciousness. Get rid of that, man.
I know. Yeah, I got some stuff to work on too.
Don't worry about anybody else.
But yeah, she was like, put your sunglasses on. I'm like, all right, fine. I'm like, whatever.
Good.
I put them back on. But yeah, I thought about that reflection and how, like, in the wintertime too. People
Yeah,
don't
there's a lot of, it's not,
snowboarders.
it's
and
not
stuff.
good.
Yep.
It's not good. You know what the thing is, if they're snowboarders or skiers and they don't wear protection, like from the sun, so goggles, let's say, not only are they getting the sun and the UV, but then the wind. The wind is rough on the eyes.
Temperature too.
Yeah, I mean, that's just that cold air. I mean, I think it would be better if it was warm air. That I guess I don't know for sure, but it's that air on the eyes. Like if you're skiing, going downhill, snowboarding, whatever it might be, if you don't have goggles on, oh, that is rough.
Yeah, a lot of guys who are wakeboarding too, they don't wear eye protection.
That's a good point too. I never even thought of that.
Yeah.
And I wonder what they wear. I mean, it's hard to wear.
No, they don't. They'll fly right off if they're on the back of the wakeboard.
Sunglasses. You got to get some kind of goggles or something.
I do see a lot of the dudes and girls. They're wearing sunglasses when they're on the boat and stuff.
Right.
But
That's
people
smart.
that don't. They need to. Yeah, for sure.
Yeah, but especially wakeboarding. I never thought about that. Yep. But I suppose if you got them and put them back on when you get in the boat, it's not as big a deal. But
how bad does drinking affect your eyes? Like liver,
alcohol, and eye disease.
Because I do know your eyes change yellow when your liver starts.
Well, yeah, I mean you can, and the reason it's not just your eyes that are changing yellow; it's your skin too. You can just see it in your eyes because your eyes, the sclera is white. So if you get liver disease, then what happens is, like with cirrhosis, the liver gets kind of scarred. It's the liver. Okay. The liver gets scarred, and then the bilirubin that it produces actually gets backed up into your body. That's really pretty severe liver disease. That can happen from not just alcohol, any sort of bad liver condition. Yeah. But there's autoimmune conditions that can do it, that sort of thing. But for your alcohol directly to the eyes, boy, maybe some dry eye. But there's not a lot of direct toxicity from alcohol to the eyes, at least that I can think of off the top of my head. Like, oh, this was caused by your drinking. Yeah. I don't see that in my office. I think most eye doctors don't see that directly.
Yeah. It just passes.
And it's mostly, what happens is those patients will come in with cataracts early on, and they can get rosacea too.
Usually they're smokers too.
The smokers, yeah.
I quit smoking when I was 30 because I was a smoker, but I went cold turkey. I was like, I can't.
Yeah, I think that's a good way to do it. It's hard, but it works.
It is hard, and I started
mindset
running.
Change.
Yeah, nice. I started running and I started going to the gym, and your senses heighten. They get more sensitive, like your sense of smell. And
once you stop after you've been not smoking for a while.
Yeah, I lived with smokers. So after I'd go for like a 3-mile run, I'd come home, and it was just your senses are so heightened. It was brutal being there. It was disgusted.
Yeah, you can't handle the smoke anymore.
And that helped me quit smoking, is being around it
permanently. You're like, I'm never doing this again. This is terrible.
It was too tough. And then I was like, maybe I do need a cigarette. So I'd start smoking. I was like, gross.
Yeah,
no, can't do it. But yep, it is a tough habit, a real tough habit to.
Oh man, it gets rough, and you see a lot of older patients still doing it. And they come in on oxygen,
Oh yeah,
on oxygen, still smoking. It's like, whoa, we want to, it's not good. It's not good, but they can't stop.
It's Chantix, man.
Well, that's true. I don't know all the anti-smoking remedies, but that's definitely one of them. But I was watching a presentation, one of those TED Talks the other day on military rations, MREs, and they used to come with cigarettes. You know what I mean? So,
wow.
Yeah. And so those guys, they were hooked. They didn't have a chance, you know?
Tough tobacco. Yeah.
Exactly.
Yep.
Oh, man.
Being in the military, you get a lot of military guys with like, they come back and they have eye conditions from being overseas or anything?
Some, not a lot. And I only see what gets referred to me from Ellsworth out here. Mm-hmm. And so usually I've seen a couple of patients for like opinions after they've had LASIK, because the military does a lot of LASIK. And if things don't go as smoothly, then I've seen a couple of those guys. I've seen a couple of guys who've had like that UV wind exposure from being abroad, you know, in the sands, Iraq,
Desert. Yeah, because that sand reflects too.
And so they have some eye conditions, some eye growths that we can remove, but nothing too chronic really that I can think of. I've seen a couple of guys come in, maybe it's really not military as much as it is kind of law enforcement, local law enforcement, who've had pepper spray and got a little too much pepper spray, even just training.
That'll damage your eye, right?
Well, I mean, it can burn it. Usually it's not a permanent thing, you know, that's why they use it.
Is that like burn a layer of the cornea
Yeah,
off?
I mean, it kind of does, but it's real superficial. So then that grows back, and it's just this, they call it like a chemical conjunctivitis. So conjunctivitis is just when the eye is really inflamed, and it was the chemicals from the pepper spray that did it. And it'll, with a little bit of TLC, that'll kind of settle down and won't be a problem. But it stops you from doing whatever you were doing that you shouldn't have been, right?
I love watching the videos on YouTube, like people just getting pepper sprayed and like the bear spray. Brutal.
Yeah, it is brutal. I don't know how you can watch that. I wouldn't
Law
be able to watch
enforcement,
that.
man, those guys are crazy. I gotta have a cop on here too. Talk about
Yeah,
some
you
stuff.
do.
Yeah,
You do. You know what's speaking of cops, we just got a Belgian Malinois, which is a police dog, and we got it from my wife's brother wanted one, and one of the canine officers in town, it was like the offspring of his dog, and so we got one. So he's at home, you know, going crazy. He's 6 months old now.
Awesome.
And
5 girls.
We're working on training this police dog. Yeah.
It's
a lot of training.
A busy guy.
I told
man.
you I was busy. I didn't know how I was going to set up a podcast. I told you there's a lot going on.
Podcast, full-time surgeon, ophthalmologist.
That's right. You can do it. Anybody can do it. You just got to really cut out all the stuff that, like, you know, all the consumption of the social media.
Man.
You just got to be on the production end.
You're motivated. Stuff. You are motivated.
Well, I mean, I don't know. You got to do something.
Yeah. Are you into fitness?
I am. Yeah. I used to do a lot of running.
Okay.
I've done, my first marathon was probably 2 years ago. And then I did one more this past year. I don't know if I'll do another one. It was kind of hard on my knees.
What is it, 21 miles?
26.
Yeah. No.
26.2. And the first one we did was in Huntington Beach. It was, oh boy, I forget the official title of it. It was a blast. My wife did the half, I did the full. And I was just, it was like a bucket list thing for me. And I was just like, I want to get this done. And so we trained for it. And it was in February. So we're training all through the winter and then did it. And I had a good time for me. I was hoping for like 3:30, and I think I was closer to 3:45, 3:44. But then I was going to do it again the next year, and something came up, and we had just moved, and there's a whole bunch of stuff going on. I was like, I can't really devote the time I need to devote to do this. Exactly. Yeah. So I found another marathon like in March. There's not a lot of marathons in March, especially in this part of the country.
Yep.
And it was in Salida, Colorado. It's like the Run Through Time marathon, but it wound up being a trail marathon. And I'm not a trail guy because I'm afraid that I'm going to fall on a rock and break my wrist. And then
they are tough.
Yeah. So, but I signed up for it because it was the only thing that we had and it fit into the schedule. So I did the full and my wife did the half again. And it was awesome, but it was brutal.
Yeah.
Like it took me 5.5 hours to finish. I was running through dirt, snow, sand, mud, grass. Yeah, there's boulders. You're up at, I think the peak was like 9,000 feet in elevation. And so that was fun. And that was actually not as hard on the joints. But I don't know.
Softer surface for sure.
Yeah, the surface was softer and varied, you know, so not as consistently hard.
Yeah, fluctuating up and down too on that terrain. That's really hard on the quads and then the hands and stuff. And you burn yourself out if you're not strengthfully ready for that. Yeah.
You do a lot of that, you know, also running plus stretching and strengthening exercises too. But
we do the Volks March every year.
Oh, sure. Yep, I've done that.
There is a lot of elderly people that do that. They walk it, and there was this older lady walking in front of me down. Yeah. And the grass was wet and she started to slip.
No.
I caught her and I was like, oh man, I caught her. And then her grandson was next to her, an older guy. And he, oh, thanks. And pulled her. And I was like, babe, let's go around because I cannot watch an old person fall. My heart will crush. I feel so bad. Yeah. I was like, oh, and it was really damp, wet. And he wasn't really paying attention to her. He was just letting her go. And it was steep.
It can be steep. That march can be steep. Plus you hit a rock. I mean, it's mostly dirt, but there's a few rocks and you get a rock the wrong way and I'd be on the floor too.
That poor lady, man. If she would have fell, she would have went all the way down the hill.
Jeez.
Yeah.
But yeah, that's my physical fitness. A lot of running, and I was gonna.
You
I have
diet well?
It used to be better. It's not bad.
Pizza?
No, yeah, we had pizza last night, and I'm not like an anti-carb guy.
Okay.
I read there's another book called
Not keto, are you?
No, I read a book called The Longevity Diet, which is basically said lots of plants and vegetables and some meat and carbs is fine. And then, but I just, there's so many diets, so many extremes, right, of dieting.
Yep.
And so, like I said, Hillary, she is a co-owner in the market. So we get a lot of organic stuff at home. So most of the stuff we eat is organic, and she likes low carb. So then I don't eat a lot of carb stuff. But I am not as strict as I used to be about it.
Yeah, I'm not either. I used to be really strict on my diet, but
I kind of feel like I should be a little better. But then when you're exercising a lot, like when you're training for a marathon, you're like, all right, I just need to eat a lot of stuff. And that was just in March. And so now I'm still, 4 or 5 months after that. I'm just kind of still trying to figure out what the next thing is going to be from an exercise standpoint. So I'm running on a daily basis, but I haven't picked the next challenge.
I like to get out of my comfort zone too and try something all the time.
Uh-huh.
And it's really good. Like I'm kind of really limited now with my vision, like what I can do.
Yep, sure.
But I trained for a physique competition back in 2016.
Yeah.
And I was already like 8% body fat. I got down there. I was cut. But it was good, like learning how to put yourself on a deficit, how to maintain.
Is fasting a big part of that too, or not so much?
No,
I read a lot about that now too.
Yeah,
fasting.
I've always done intermittent fasting because that's just
works
how
for
my
you.
body works.
Okay.
Like I can't eat like early in the morning. It just makes me feel uncomfortable all day. I get bloated. So, and they did recommend. I was using this guy as a trainer. He recommended that I eat in the morning, and I couldn't do it, so I dropped him.
Oh, okay.
I was like, "You're out," and I just started doing my own thing from 12 in the afternoon to 8 at night, and filling my meals in. And I put myself on a deficit of just like each 2 weeks I change it up, like 200 calories down, and then grams, and made sure I got enough protein. And I was all about the carbs, like I was carb loading, and then fluctuating and dropping, carb cycling. And yeah.
Did that work?
It's super easy to do. Keeps you mentally focused. It doesn't hurt your body. I felt normal.
Yeah, that's one thing I found. If I did low carb and then went for a run, like I would feel just terrible. Like, so if I did a long run but didn't have carbs the night before, it would just be miserable because I think my muscles weren't filled with glycogen to do that long run.
You tax your body quite a bit.
Yeah.
Yep. And especially your joints too when you're running. You do need some sort of sodium intake in order to keep the water in your joints and stuff. I did have a well, he hates the word personal trainer.
Yeah, okay.
He's a coach.
Okay.
And we were talking about fitness and stuff, and it'll be on a podcast before us.
Cool.
They can check out. But yeah, we run over like how it affects your body and stuff, and people are scared of like sugar and salts and stuff. It's moderation, but you do moderation need it in your body. Yeah,
that's the key.
Yeah,
that's
for
the key
sure.
to anything.
And the bad thing about sugar is it's not really that bad, like in small doses,
right?
Because you need that glycogen. But it's just the things that it comes with, like butter, lard, like all that stuff that they put with
dyes, chemicals,
oils.
all that stuff. Yeah,
and they don't even use like olive oil, but it's just like the vegetable oils that are bad.
Yeah, exactly.
And refined carbs are really bad for you. Like if you stay away from the refined carbs,
the white
carbs,
bread,
natural carbs are way better for you.
Grains and things like that.
Yeah, potatoes. I mean, that's okay.
Yeah.
Yep.
Man. Boy, we could talk forever.
We could go hours and hours.
How long are we on for?
It's already been an hour, and we're running out of memory, so we'll probably call it quits here.
Yeah, we can cut it off. But I want to come back. I told you this. I want to be a sponsor. I want to come back.
We'll have you on.
And I bet you Hillary could be on here too, talking about the market and healthy eating and things like that. I mean, that's the thing about podcasting when you're interviewing, it never ends. And then, because by the time you're done, you just start over with the first one.
Before we do quit, I went to that health food store by, I think it's called Beetroot.
There's Breadroot. Yep, Breadroot. That's on like Fifth Street or something like that.
Yeah, I went there, me and my girlfriend, just to check it out because I was really curious. and everybody in there had really nice looking skin.
Oh.
I was evaluating. I was walking around, and there's this girl with like really nice looking hair and skin and no makeup, but she looked probably 40s, but her skin looked 20s.
Interesting.
All of them did.
Interesting.
I mean,
there's all sorts of skin supplements and things like
yeah,
that.
even the older ladies, they looked good. I was like, damn, I need to start eating here. Like,
yeah, definitely.
getting my
Once you
groceries.
put it, your body's going to reflect what you put in it for
Yep.
sure. I mean, I believe that. That's why.
And your eye health too.
Well, your eye health is going to
Absolutely.
reflect. Well, yeah, that's true for sure with dry eye, and maybe not like overnight, but definitely over a series of years, cataracts, all that sort of stuff.
Keratin. So I was reading about keratin supplements for your eyes too.
Really? Okay.
Yeah.
Maybe I don't know. As there's the eyes are made up of keratin, and that's the keratocytes or like the cornea. But keratin's more. I think that more for nails and stuff. Such.
Yeah. I don't know. Maybe it was a bullshit ad that
I'll
I was
have to look
reading,
it up.
but
I'll look.
yeah.
I'll look. I don't know everything, and there's always new stuff.
Do a little research next time for
Yeah,
our next podcast.
Absolutely.
All right.
Dude, I love your setup. I think it's awesome. I'm so happy to be on here and kind of just, shoot the stuff and talk about eyes and eye health and eye surgery. And, if anybody has any eye questions, things come up, just check me out on Facebook, Steve K MD1, or YouTube. We got a YouTube channel going,
What's
with
your
some
YouTube
eye
channel?
surgery. It's at Steve K MD1.
Okay.
Steve K MD1. So there's Facebook, YouTube, Instagram. It's all kind of the same. And then, or give us a call at the Eye Institute.
All right, man.
Hey,
All right.
Brandon, my pleasure. Good to see you.
Hey, thanks for coming on for sure. We'll talk to you guys later. See you, folks.
Bye now.